Hello there, welcome back. This week I wanted to talk about some of the unique strengths that's occurring at UIC, and I wanted to bring everyone up to date on some of the things that's occurring. One of the things that is really key here is finding our path forward through this event. And one of the things I wanted to inform you about is there's a concept that oftentimes we talk about data-informed decisions, but data is needed to basically inform what we call information, and information then informs what we call knowledge. And what we need to do is really knowledge-based decision making, and that's what we're doing here at UIC. So there's an old saying in history of war, and that is, in war, oftentimes the truth is the first casualty, and not here. In this, we need to think as a dental profession about what I call the fog of data that is coming out right now, and what is really needed for balanced risk mitigation. If you look around right now, there's all sorts of discussions about dentists doing genetic testing, antibody testing. You're seeing point of care dipsticks that are going around. All of this is dealing with the fundamental issues that we talk about in terms of evidence-based decision making, and that is the concepts, for instance, of measurement, the sensitivity, specificity, positive predictive value, negative predictive value. All of these various terms that we hear about are important for us to think about as we make critical decision making for our patient care. To avoid that confusion, UIC has some unique strengths here, one of which is we have a very key, innovative strategic plan, which I call UIC LEADS, which is leadership, excellence, aspiration, discovery, and sustainability of our mission. Now, tomorrow, Dr. Scott Tomar is joining us from the University of Florida, and Dr. Tomar is now our new Associate Dean for Prevention and Public Health Sciences. Key time for us to have this expertise with us. We also have some key strengths in terms of an absolutely incredible faculty that has actually been able to create a range of curricular innovations, assessments, and approaches almost on the fly to assure the students the very best in a high quality professional education. I'm extremely proud of them, as every student should be, because it's incredible what they've done. Yes, the sequence may be off, and the faculty and the administration and I personally are all dedicated to a wonderful, comprehensive, and complete dental and specialty education for every student. We also are dedicated to a safe work environment, and a lot of work has gone into that. And of course, I'm very dedicated to continuing a very strong discovery mission, taking the key advancements that will improve health. So what's the reality of our situation? And that is, this virus is going to be with us for a while, and we have to be prepared. There will be, and we should expect, times where there'll be repeated cycles of infection, repeated cycles of shelter, and then we recover. It is simply the nature of a virus. And I thought one of the best sayings I've ever heard was from Nobel laureate Sir Peter Medawar, who said way back in 1977, a virus is simply bad news wrapped in protein. And boy, have we seen that. So talk about the simulation and clinic plans that we have, and we are using what I call a hierarchy of control to manage risk for the safety of our students, our faculty, and of course our patients. Some of the principles of these plans are, of course, aerosol mitigation, and a lot of work is going into that, and I'm working with College of Engineering faculty, facilities engineers on campus looking at aerosol mitigation approaches. We will be emphasizing strict physical distancing. We will be looking at avoidance of any proximity for the logical reasons that we don't know what is the rate of actual infection in the community and the large number that may be completely asymptomatic, which is in the nature of viral infections. We are using assigned teams of students with an assigned faculty, and those teams will stay together for each of the activities, be it in the simulation clinic or in the planned clinic reentry. And we'll be using bursts of on-site activity to be able to achieve the simulation or patient care needs, but with a expeditious, if you will, exit from campus as quickly as possible for the safety of everyone. Research will continue, but it will use strict physical distancing and limitations of direct contact. We are looking at asynchronous schedules to allow the maximum activity and scheduling for students' pre-patient simulation, and clinical experiences. This means probably more sessions, probably some longer hours, and alternative times that are all in play. Obviously, we're going to be emphasizing PPE training and equipment. And one of the things you have to realize is that PPE is just one part of the solution, but in the hierarchy of control, it's really the last thing. We really need to be thinking about all of the engineering controls we're working and the other kinds of approaches. So it's really up to each student and each staff and each faculty to assure the excellence in terms of PPE equipment and activities. So my promise to you is we will use the best knowledge-driven decision-making as we get through this. My goal is transparency in this time of what I call a viral fog. UIC has a wonderful mission and vision, and the incredible spirit of cooperation on this campus is simply inspirational. Thank you very much, and more to come.